So, other than this, how important is diet and oral health for an infant or a toddler?
The basic nutrition starts for an infant, for a child from its infancy. So if you look at the national breastfeeding guidelines that is there, usually it is said that for at least 2 years, the child must be breastfed because breastfeeding has a lot of advantages. It not only provides nourishment, it also provides immunity to the child as well. And that from that social perspective, that is what the pediatrics board says. Now, what happens in feeding practices of these infants is that when the baby is very small, the mother feeds it multiple times, including the night, which is okay. The baby needs that nourishment. But by the time the first tooth erupts, it becomes very important to make sure that nighttime feeding is gradually stopped. What happens is at nighttime, you don't get much of saliva. And because saliva is not there, the milk starts pooling in the mouth. And once it gets stuck on the teeth, it forms an external media for the bacteria to come in and start decay. So, what we recommend to the parents is as soon as you start feeding the child, make sure that you do some wiping after the feeding is done. So, you can take some sterile tissue wipes or cloth and wipe gently all the milk which is pooled. And up to 6 months of age, we say it is exclusive breastfeeding. So please do not feed the child with anything other than the mother's milk. So that includes your juices, your jaggery sweetened water, or any other kind of sweetened solutions. So that is very important. And by 6 months of age, we often recommend what is called as complementary feeding. That is, the child has to start with other foods. So this is the most important part of diet that we are talking. So by the time the child is about 1 year of age, he has already some 6 to 8 teeth present in his mouth. We need to start with some brushing, and the child also has to start learning to eat solid foods. So we encourage the child to eat what the parents eat and what everybody eats, and not mashed up food. Because if you start feeding mashed up food to the child does not learn how to bite and chew. And we have seen children who are up to 2 years of age who've been so used to this mashed up foods that they will throw up if they get any solid, including your roti or chapati piece, they can throw up because they have never learned to bite. So the child has to learn to eat all solid foods. Now, this also has a perspective from the dentist as well, because soft and mashed food always sticks to the teeth. When you have hard and fibrous food, they tend to get easily cleaned. So the diet is very important until by the time the child is 2, the child is already consuming what an adult is consuming, but in smaller quantities, of course. The brushing, of course, starts by the time the first tooth erupts. We need to start using a small finger brush, we start to clean it. But we usually do not use any paste in a very young child because they tend to swallow the paste. By the time the child is about 1.5 years, we encourage maybe half a pea size, less than a pea size, less than half a pea size of paste to be placed on the brush, and we encourage the parents to clean all surfaces of teeth. But if the child by age 3 or 4 is already presenting with carious lesions, that is, decay is already starting, we recommend a fluoridated toothpaste. And we definitely ask the parents to brush twice or thrice a day, encourage a lot of water intake. So, this is very important from both dietary and cleaning part for a child.
Wonderful, ma'am. As we can see that there is a lot that parents can learn from a pediatric dentist. So, when is the best time to see a dentist for the first time for their children?
That's a wonderful question, Dr. Aditi. Uh, my answer would be if you are planning for a baby, visit the pediatric dentist. So we call that prenatal counseling. There is a lot of prenatal counseling that is done by an OBGYN. They talk about healthy habits that has to be adopted by the mother, the father before they even conceive. So same thing, before they even plan to conceive a baby, the mother has to be made sure that she is having good oral health. Because if they have problems during pregnancy, that can also bring about a lot of problems for the baby. We've seen that periodontal diseases, gum diseases in the pregnant lady can lead to low birth weight and increased birth difficulties. So Before you plan a baby, go to a dentist, make sure your teeth are fine and everything is okay. Now, the other thing that I would also like to share is that most of the time, the bacteria that is responsible for decay in a child is often transmitted by the mother, the father, or anybody who is very close to the child. So, if you have a lot of decay, that means the decay causing bacteria